Hi, my name is Sanjay Gupta. I'm a consultant cardiologist in York. And today I wanted to do a little video on the subject of ectopic heartbeats. Um, and The question predominantly is, are ectopic heartbeats dangerous? So I've done a few videos now on palpitations and ectopic beats, and by far and away, the commonest question I get is, are these dangerous? So this video is for those people who get intermittent skipping or fluttering of the heart, where it almost feels like a big missed beat followed by a thud. So in essence, I'll tap it out. This is what the heartbeat feels like. Normal, 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 and then missed beat, and then thud. Normal, normal, normal. So okay, and this is incredibly common these days. We get a lot of patients who come in complaining of ectopic heartbeats, and there's lots of reasons why people are getting ectopic heartbeats. And I've done a series of videos on sort of lifestyle and changes in lifestyle that can be made to overcome ectopic heartbeats. A lot of people then go and have an ECG and a 24-hour ECG, and they're told, look, these you've got ectopic heartbeats, they're not dangerous. But a lot of people don't feel reassured by that. And so today I thought I would try and tackle this issue. Are they dangerous? And the answer is yes, they can be dangerous, okay? But only in a minority of patients. And the majority of times they're not dangerous. Who are, so there's two things, okay? The first thing is, do you have a structurally normal heart? Is your heart otherwise a strong heart or a weak heart? Now, why is that important? Because when you get an ectopic beat, it means that your heart is being activated from somewhere other than where it's meant to be activated. That's not a terrible thing, but it does mean that the heart is not going to, for that one beat, the heart is not going to beat as strongly as it would. Now, imagine if you have a series of ectopic beats. So if you have 20 ectopic beats, during those 20 ectopic beats, the heart is beating much weaker than it would. Therefore, less blood is going around the body, and the body will suffer symptoms in keeping with less blood flow. So you will feel tired, you may feel breathless, you may feel dizzy. And also the heart may lack blood itself, because the heart, although it's a pump, it also needs blood to supply itself, the muscle. So if you've got less blood going around, the heart is going to get less blood. However, if you have a strong heart, if you have a normally strong heart, then the heart will cope with that, okay? But if you have a weak heart, or if you have an abnormal heart from childbirth, then the heart may not be able to cope with a lot of ectopic beats in a row. So if you get, let's say 100 ectopic beats in a row, the heart may not cope with that if it is already weakened. And therefore, the first way to try and define whether your ectopic beats could be dangerous or not is to try and know whether you have inherently a strong or a weak heart. And the way to do that is to have an echocardiogram. So you go to your GP or your cardiologist, they scan your heart with an ultrasound, and they see whether every contraction, every heartbeat results in a meaningful, strong contraction. And they will give you something called an ejection fraction, which tells you how much heart, how effective the heart is. And we usually use an ejection fraction of 60%. So if you have an ejection fraction of 60%, then by very definition, that tells you that you have a strong heart. In addition, it's important to know that the valves are okay, there is no scarring of the heart, and an echocardiogram will tell you all that. If you have a strong heart, then in general, your palpitations or your ectopics are not going to be dangerous, okay? On the other hand, if you have a weak heart, then they could be dangerous. The second thing to say is that it is useful to know if the ectopics get worse when the heart is stressed or get better when the heart is stressed. So Sometimes ectopics can be a sign of irritability of the heart, and sometimes it can mean that this irritability is being caused because the heart is lacking blood for whatever reason. So if you have heart artery narrowings, that can cause the heart to lack blood, and that irritability can be manifested as ectopic beats. But usually, if that is the case, then you find that there is an increased preponderance of ectopics or palpitations on exercise, which get better with rest. It is a very reassuring sign if the ectopics get less on exercise. And therefore, I often ask patients when they come to me and say, oh, I'm getting ectopics, I say, do you get them at rest or do you get them more on exercise? And the majority of people will say, I get them more at rest when I'm thinking or stressed, and I get less when I'm exercising. And I tell them that that's a good sign, and it is a good sign. But if you are finding that your ectopics are getting worse on exercise, then I think that could possibly signify a bit of danger, and it's worth getting that checked out. Now, the third question is, can having lots of ectopics cause your heart to weaken in some way? And you're right, because the ectopics are coming from somewhere else, the heart is not being activated in the way it's meant to be activated. And so if you are getting, say, 25,000 ectopics a day, if 25% of all your heartbeats are ectopic beats, then it is quite likely that as time progresses over a number of years, your heart could weaken. And if that happens, then you can develop something called heart failure, where the heart becomes weak and is not able to fulfill the body's requirements. And so it is quite nice to get the number of ectopics you're suffering from quantified by means of a 24-hour ECG. If you're getting, 1,000 ectopics a day, that's by no means dangerous. I wouldn't recommend that you do anything about them. If you're getting 25,000 ectopics a day, then yes, I think it is worth trying to work out why you're getting so many ectopics a day. You should definitely have an echocardiogram. You should definitely have an exercise test, and it is definitely worth suppressing them. And the way you can suppress them is firstly try and identify things in your lifestyle that could be contributing to them, but also using things like beta blockers to suppress them. It doesn't mean that you have to have beta blockers for life. Sometimes you can suppress them, and then after a few months you can come off the beta blockers that they don't recur. It's quite intangible sometimes to try and work out why ectopics come on and why they really become very frequent from time to time. But I agree that if you are getting a lot of ectopics, then it is worth suppressing them. Finally, if you're getting a lot of ectopics and they can't be suppressed by beta blockers, then another option is to go and see an electrophysiologist who can ablate them for you. And I do recommend ablation in people who are getting extreme numbers of ectopics, for the simple reason that I worry that even though they may have a strong heart now, if they continue to have that number of ectopics over a period of time, they could develop a cardiomyopathy or a weak heart. And that's what I do. But if you don't have any of those things, then on the whole, your ectopics are not serious, and they will just go away with time. So I hope this has been useful. I'm always happy to chat to people about their ectopics, and if you want to get in touch with me, you can do so. I work at York. I have a website, and you can send me messages using my website, and I do try and respond whenever I can. I have a secretary, and she's on this number. Her name is Jeanette, so you can get in touch with her if you want to speak to me. But I would prefer if you get in touch with me through the website, because then the message comes directly to me. I'm also on Twitter, and I'm also on Facebook. So I wish you well. Thank you for listening, and all the best.